So Mary Jane, thank you so much for coming in and doing this video for us. I really do appreciate it. And
You're welcome.
Just for our viewers, I want to let them know that you're a denture wearer and you have been for a number of years. So do you mind telling us when you lost your teeth?
I was 18, so which is a long time ago.
So you were 18, and then when I saw you for the first time, how many sets of dentures had you had made?
Only 2.
So you were on your second set of dentures?
Yeah.
Okay, so and that was that was 2 years ago.
Yes.
And you saw me and you had just recently had them made?
Yeah.
So tell me about that visit. You came in to see me. What was that about?
Well, I was in pain. I couldn't eat anything. I had sore in my mouth, and nobody really wanted to help. So I got your number and I called you, and you took me right away, and you kind of tried to make it fit so I'll be more comfortable, and I was more comfortable. So I was able to eat a little bit more, which was good.
Perfect. So you're, so tell me a little bit more about the discomfort. You couldn't bite down?
I couldn't bite down. Everything had to be soft. I couldn't eat really nothing hard. So everything was soft.
And so how about, were they moving around a lot?
Yes, I had to kind of put stuff to...
Yeah, to hold them down?
To hold them down.
And am I being truthful when I say you're kind of a social lady? You probably...
Yes.
you go out and you do a lot of things, so that must have been a difficult thing for you.
Yes, it was.
Embarrassing? Yes. Was it embarrassing?
Yeah.
Yeah. Which is not a funny thing because it's real for you, right?
Right.
So I saw you, and we were able to adjust your dentures, at least get them so that they didn't hurt.
Right.
Yeah.
I was able to eat more, and at least I was able to eat.
And I've spoken to many of my patients that have worn dentures for many years, and I talk about that you lose bone over the years and you don't realize it, and then many people get into a situation like you got into where now they can't get comfortable. So I was so glad that I made you comfortable. And I actually did you a disservice at the time because I told you couldn't have dental implants.
Right.
And as badly as I wanted to do them, I said she can't do them.
Right.
So for our viewers, we always recall our patients every year to clean their dentures and talk to them. So at a recall, I decided to take a scan, a CT scan, and to my surprise, I could see that I could place 2 dental implants.
Right.
That must have been great news for you, huh?
Sure was.
Yeah, yeah. And so, so tell me a little bit about how that procedure was. So what I did was I placed 2 dental implants. So tell me how the surgery was for you, your discomfort level. Tell me a little bit about that.
It's the only thing that I would advise everybody. Get yourself put to sleep, because when they squeeze it in, it's a terrible sound.
It's the sound, huh?
It didn't hurt. I didn't have no problem. Even afterward, it didn't even hurt. I didn't have no pain or nothing. It's just the sound. If you can take the sound, you're fine. I was able to take it, but it still was like, ooh.
Yeah, you didn't like that sound.
I didn't like the sound.
But there was no discomfort whatsoever?
No, it was no discomfort. I was very comfortable. No problem whatsoever.
And how were you after we placed the dental implants the next day? Were you comfortable?
The next day, I wasn't in pain. I had to watch what I eat. Everything had to be soft because I had a diet to make sure until they get healed. Right. But once everything started getting healed and everything, I was able to eat a little bit more and more.
Perfect. So, and then you healed for a few months.
Yeah.
And then we fixed your denture to hook them to the implants.
Yes, you did.
And so now tell me about that. Now how is
Now it's great. I can eat anything, pretty much what I want. I did the peanuts, I did the carrots, I did the apple, which I couldn't eat before.
You ate peanuts with your dentures.
I sure did.
That's amazing, amazing.
With no problem.
Yeah.
Which I love it.
And you're a beautiful lady, and to have teeth now that stay down, your confidence must be much better.
Oh yes, it sure is.
Yeah.
And I'm very happy.
Very good. So I'm glad we were able to place the dental implants.
Yes.
So your quality of life has
a lot better.
A lot better.
Yes.
So now you can go out and with your friends, and you don't have to worry about them
that's
flipping
right.
up. Yeah.
That's right. Yeah. And I can eat anything I want. I don't have to worry.
Very, very, very good. So would you recommend this to patients?
Oh, definitely.
Yeah.
I would advise anybody, if they can do it, go and do it, because you're not going to regret it.
Yeah, very good.
You just have to have patience, and you'll be fine when you get to the end.
Very good. And one final question for you. So one of the things that we get asked a lot here is the cost of dental implants. Dentistry is known to be expensive. Dental implants are expensive. So when you're confronted with the okay, I want to have dental implants, and I gave you the cost. Tell me how you made the decision to go forward with the dental implants. What was in your mind to justify the cost of the dental implants?
When I went home and I asked my husband, can we do it? He says, yes, we can. I said, okay, we're doing it. And I had an insurance, so the insurance
Paid
helped
some.
out, so which it was good. But I would have done it no matter what, I think.
So knowing what you know now, would it be fair to say that you'd pay twice as much for it if it be because of the
definitely.
quality of life that it's changed
Yes.
for you?
Yes, it really.
Well, I want to thank you for being very open and upfront, because I think that you will, through this video, help very many patients. And
I hope so.
I really appreciate it.
I hope
Okay?
so,
All right,
yes.
thank you so much for coming
You're
in.
welcome.
Okay.